Chairman, thank you, and to the new ranking member, I look forward to working with both of you. Dr. Shulkin, congratulations.
Thank you.
And pleased for you and your family and those that are perhaps watching today's hearing. And I appreciate the visit you made to my office yesterday, and we talked about some numbers and some statistics that were important to me. And I told you I may bring them up in today's hearing, so here we are. And I want to thank all the VSOs and all those that are in attendance today for sharing and expressing your concern for this particular position, which is important to all of us. But I want to compare some of the numbers of today when it comes to backlog claims, and I apologize if this has been topic discussed prior to me getting in here. But the backlog claims today versus December of 2013. Today, we have a 28% backlog, about 1,235, I guess, to be exact, versus December of 2013, it was 67%. So you can see that we've made some progress, and I appreciate the men and women back in Nevada that's working for us and doing a great job back there to reduce this backlog. Today, the total pending claims is 4,416 versus 2013, which was 6,622. But the problem, of course, is in the appeals. We talked about this a little bit. Today, it's 2,731 versus 2013, where it was 1,140. That's a 140% increase since 2013. So as you know, as we've pushed on the, and staff back in Nevada have pushed on this backlog claims for pending claims, obviously, the problem is that we're now seeing these appeals balloon.
Yes.
What process do you see in the near future that will address these appeals?
Senator, first of all, thank you for recognizing the tremendous progress that the benefits team has done. This has been an example of modernization of VA that has taken the numbers down dramatically, nationally from over 700,000 to today about 80 or 90,000, and we're going to do better than that by the end of the year.
Good, glad to hear that.
But in the appeals process, we have no hopes without a Modernization Act being passed through Congress to fix the appeals process. It is a broken process. It will not get better without your help, and we certainly hope that you and your colleagues will pass a Modernization Act this year.
The average days to complete now are 124 days versus where it was in 13. In Nevada, at least, was 433, almost 434 days. So you can see that there's some real progress there. And I just want our veterans to know back in the state of Nevada how hard that office is working, and the men and women that are committed to our veterans to make sure that they do get these benefits and services that they need. I'd like to talk about doctor shortages for just a moment. We have, in the state of Nevada, felt a real impact. Nevada ranks 47th in the nation for physicians per capita and 48th for nurses. And as you know, on top of that, the VA is competing with the private sector for hiring. Given your experience, especially in running hospitals, what recruitment and retention efforts and initiatives will you be pushing to ensure that we get high-quality medical professionals joining and staying at the VA?
Well, recruitment is our key issue, and I want people to know that working at the VA is a tremendous privilege. I see patients in the VA, and I'm proud to work with the men and women that serve in the VA. So people read about all the bad press and the media events, and they say, well, I may not want to work there. But I can tell you, when they come, they see an environment that really is an extraordinary place to work. So I want people to come. When you've given us the tools like the Choice Act, we have hired 18,800 net new staff because of the authorization that you gave us. I hope, as Secretary, if I'm confirmed, that you give me the ability to recruit and retain even further. So when the CARA legislation passed, inadvertently, I believe, or at least I hope, our recruitment dollars were put into the CARA Performance Awards. So it actually removed a tool that we used in the past to recruit and retain the very, very best. And I would like to have the ability to have what we had before, which is the dollars available to do what you're talking about.
Doctor, just because I'm short on time, can you give me your opinion on medical scribes, and do you believe that they will help these VA physicians in their workloads?
We are looking at the medical scribe issue. The private sector has used it very successfully, and we're starting some pilots in that. That's something that I think has some promise.
How about more doctors in rural areas?
We need them, and we need to expand our graduate medical education programs in these rural areas. We'd like to do that as well.
Thank you, Mr. Chairman. My time's out.